The governor has given his approval for schools to reopen, but even he admitted this is really a decision that parents, teachers, and students are going to make about whether they feel safe enough to return. And before that can happen, a lot of homework has to get done as the debate rages across the nation. Governor Andrew Cuomo's decision to allow schools to reopen, including the largest public school system in the country here in New York City, is a remarkable turnaround for the state hit hardest by the virus, with more than 30,000 deaths. But now the infection rate is less than 1%.
If anybody can open schools, we can open schools. And that's true for every region in the state, period.
A decision welcomed by many parents and teachers.
We tried to Zoom with the kiddos, but it was really difficult. A lot did not have access to devices. A lot did not have home support.
But every school district still must submit a detailed plan about exactly how schools will operate and how they'll address concerns like testing and contact tracing.
Our biggest concerns are that we have the social distancing in place. That is important. We know when you go into a supermarket, you have to be 6 feet from the next person. We want that in the schools.
Outbreaks already happening in schools that have reopened. In a search of local news reports, NBC News found over 60 cases of students and staff testing positive in Tennessee, Georgia, Indiana, and Mississippi. In Alabama, the entire varsity football team and coaching staff at St. Luke's Episcopal School went into quarantine after a player showed signs of COVID during a practice. Also fueling anxiety, a new CDC report about the deadly COVID-related illness affecting children, MIS-C, or multisystem inflammatory syndrome. Through the end of July, 570 cases in 40 states and D.C., almost two-thirds requiring time in an ICU, and 10 deaths. This 10-year-old was rushed to a Pittsburgh hospital, his temperature soaring and struggling to breathe.
It looked grim when he was in ICU, and I guess I thought that he wasn't going to make it out.
He survived. Also on the medical front, Dr. Anthony Fauci now says not to expect a vaccine that's going to guarantee protection against COVID.
We don't know if it's going to be 50% or 60%. Hopefully, I'd like to see 75% or more. But the chances of it being 98% effective is not great.
He went on to say that means the nation cannot abandon the public health approach. Masks, hand washing, social distancing, testing and tracing to try and control the virus. The question now, of course, is how to implement all that into the nation's schools so that everyone feels safe enough to return.